She called Tuesday, she found her horse foaming, and she didn't know why. Okay, so she brought her Tuesday afternoon. So we checked her mouth, everything was okay, no problem. So we scoped her, and all of a sudden we saw the soft palate displaced, permanent displaced, pushing up the epiglottis and everything. And at the point that like 20 minutes later, she almost had open like that. So she was maybe asphyxiating herself. So we did a emergency tracheotomy, and we didn't find exact cause what happened. We suspect there's an abscess somewhere because the X-ray doesn't show nothing. The ultrasound is an suspected area that maybe an abscess, and she's doing a lot better after. And yesterday we scoped her yesterday. At least the displacement is still there, but we can see half of the larynx before we can see even the 10% of it.
Gotcha.
So today we're gonna scope her to see how she is doing now.
So the swelling went down, and now she's still having a reduced
Airway flow.
airflow because of this swelling, but it looks better. So now we have an upside down image, but basically this is the entrance of the larynx. This is where all the air is gonna go directly to the trachea, and obviously then to the lungs. So that's the trachea. So since she has all this swelling in here and the soft palate is pushing all the structures up, her airflow is very restricted. So it should be like a whole oval, and it's kind of half of it. So that's why we placed tracheostomy. So now she's basically breathing from here and not using this airway. So we've done that for two reasons. She was about to get collapsed because it was 90% of the airflow of the rima glottidis was obstructed, so the air could not go in, and she was starting to get in distress. And the second reason why is because we don't know what is the reason of the swelling. We are giving the airway a rest, so that swelling can go down. The upper airway is not working; it's kind of resting. We are medicating. She's on antibiotics, anti-inflammatories, and local anti-inflammatories as a spray, while she is breathing directly through the trachea. So now our goal is to reduce as maximum this inflammation and see if we can find the reason of this swelling. And once we find out, we can proceed. But we have some differentials. She might eat something with a foreign body, such as a piece of wire or a piece of wood. We took x-rays, we did ultrasound, we explored the mouth, we did everything we could, but since the swelling is still pretty severe, we cannot find what is causing that. Other reason could be maybe she has a congenital or an acquired deficit or anomaly of the larynx, such as a subepiglottic cyst or an abscess or something that is pushing all the structures up and is restricting her airflow.